Well, Monday may be a critical day for people waiting for more answers in the death of Elijah McClain. That's when the City of Aurora, Colorado, is expected to release results of an independent investigation.
News Nation reporter Lori Jane Gliha has more on the case, including an evaluation of paramedics' use of ketamine to sedate McClain moments before he went into cardiac arrest.
Medical crews don't wear body cameras, so the Fox 31 problem solvers obtained these videos from the Aurora police. Many capture the moments leading up to.
I took a swing on my partner and then tried throwing a chair and then we jumped on him.
He got hit twice and I punched him in the face 3 times.
I even dropped some gasoline up in the stove.
You drink gasoline?
And the seconds following a paramedic using ketamine to sedate a patient in 2019 and 2020.
All right, run the gurney.
Medics give the drug under a state waiver program if a patient shows symptoms of excited delirium or extreme or profound agitation.
2 people down out there, 2 people down.
Emergency providers insist this keeps themselves and the patients safe when someone is out of control. State guidelines say ketamine for this purpose is an emerging treatment, and many physicians question the excited delirium syndrome's existence. Our Problem Solvers investigation found state medical leaders started using the term extreme agitation instead of excited delirium late last year. To find these cases in Aurora, the Problem Solvers first filed an open records request for patient care reports with private health information removed. Then we found every report in which medics mentioned excited delirium in 2019 and 2020.
No, I am an introvert.
That includes the case of Elijah McClain.
Just drive it right behind his ear.
Although these body cameras do not capture everything, they show a glimpse of the behavior that led paramedics to sedate a patient.
There's no test that we can do in the emergency department or in the hospital that's going to say yes or no, this is excited delirium. So a person can go from very cooperative to very agitated, in really seconds.
Dr. Joshua Solano is an assistant professor at the College of Medicine at Florida Atlantic University and a practicing emergency physician who recently presented new ketamine research for a national medical group. In a study of approximately 80 patients, he found those with cocaine in their system had a greater risk of needing intubation or help breathing after receiving ketamine. He still says the drug has a good safety profile.
Where the other medications take much longer and don't work quite as well. So there is always that it's a new tool, and so people maybe use it a little bit more. And so that just has to be looked at a departmental level, and that's a part of quality improvement.
Means no worries for the rest of your days. It's our problem-free philosophy.
Records show this guy had been running around naked and yelling.
Help me, oh,
And police tased him 5 times before they could handcuff him.
Can we get this guy like some Versed or something?
We asked Dr. Solano to look at another video.
What are you doing?
Hold still, man.
No, you're not hitting me with nothing.
This man has his arms and legs tied with multiple first responders surrounding him. He can answer questions coherently and requests no injections.
No. I said no.
This is challenging because this patient, I agree, I don't think he meets true excited delirium criteria based on the fact he is, giving some answers, but he is clearly somewhat combative. He does have a head injury and he's bleeding from a gash on his head. This patient 100% needs to go to the hospital, and I think it's appropriate, to give him medications to sedate him and get him safely to the hospital.
Dr. Solano says he understands why ketamine has become a controversial topic in Colorado and says it's important to continuously review how medications are used in order to improve.
The state and the EMS is obviously going to be defensive because it's really hard to, I think, look at a few cases when the vast majority of cases go safely and the vast majority of patients do well. There's room, obviously, for improvement in anything we do.
Aurora declined an interview with us, but we learned when we requested these videos, they delayed the release of some of them so they could do their own review. They've also said they're looking at how body camera can help them with future reviews. Meanwhile, the city will soon be deciding whether or not to let ketamine back on the ambulance rigs or whether more scrutiny is needed.
Lori Jane Gliha, News Nation.